Welcome to this brief animation, which will give you an overview of care planning and reviews in shared lives. Please refer to the accompanying training brief for more detailed information. Shared lives provides a very person-centered approach to support, and careful, detailed consideration is given to the planning of a person's care and support. This animation will look at how care planning and reviews work in a shared lives arrangement. The care and support needs of the individual looking to access shared lives is first advised at the point of referral, usually made by a social worker. The referral information that would be requested from the social worker includes Care Act Assessment. The scheme would need to see an up-to-date Care Act assessment. Support Plan. The scheme would require information regarding other support in place, such as daytime activities. Any other documentation such as MC assessment, risk assessments, etc. Shared Lives Referral Form. There is more information on making a good referral in the Resources section. Following the referral, shared lives schemes may ask to meet the referred individual themselves, to clarify the information shared by the referrer. This will allow the scheme to build a clear picture of the individual's care and support needs, their likes and dislikes and personal interests, so they can begin to assess which shared lives carer the person could be best matched with. During the matching and introductions process, schemes ensure that shared lives carers and the people who are seeking support can get to know each other and test drive a shared lives arrangement before entering into it. When an arrangement is agreed, all necessary information will be recorded in the license agreement and arrangement agreement documents. For more information on matching and about arrangement agreements, please see the Ensuring a Successful Arrangement Learning module. Once the arrangement is in place, shared lives carers are provided with ongoing support and regular monitoring visits by the shared lives scheme. Monitoring visits are usually every 3 months. These are in addition to annual reviews and the care plan review, which is completed by social workers. Wherever possible, shared lives workers and shared lives carers will involve the person and/or their representative in what is being recorded about them and will discuss and show it to the person at the time. Key actions around record keeping include that information is recorded on paper and/or electronically. The scheme and shared lives carers keep records which include any significant events. The person will be given copies of the most important records, agreements for example, and can also ask for copies of other documents, if they wish. The person has rights around the records held in accordance with GDPR legislation. Any records kept about a person living in a shared lives arrangement should preferably be stored in a locked cupboard or drawer and electronic records password protected. Only information which is important and relevant to the person's shared lives arrangement should be kept. When the shared lives arrangement comes to an end, all the shared lives carers records should be sent to and stored at the scheme office in accordance with GDPR, and the shared lives carer deletes or destroys their copies. People in shared lives arrangements have a right to know what kind of information is being kept about them. Their shared lives worker can tell the person more about this. If other people, such as a relative, ask to see the person's files, the shared lives scheme or the shared lives carer will not permit this, without the person's agreement. During regulatory inspections, inspectors sometimes ask to see a few of the files of people who are supported by the shared lives scheme. The regulator treats all personal information as confidential. Sometimes it is necessary for a shared lives scheme to coordinate the services provided, that the person needs or wants to participate in their support. For example, the person may require support with their dental appointments, with getting home from a club or attending college. The shared lives scheme workers will do their best to ensure the person's needs and wishes are met, whilst only sharing relevant information. The person's right to confidentiality will be respected throughout this process. Shared lives schemes have strict policies and processes in place with regards to supporting people with medication and follow Shared Lives Plus guidance, which was developed using information and resources from the National Institute for Health and Care Excellence, NICE. Wherever possible, shared lives schemes are committed to enabling people supported by shared lives to take responsibility for their own medication. Where it is not possible, the shared lives scheme will ensure that shared lives carers understand the principles behind the safe handling of medication, through mandatory training and ongoing development. Shared Lives has a person-centered and rights-based approach, so people supported by shared lives have a right to be involved in discussions and make informed decisions about their care, to be as independent as possible and self-administer medication where appropriate, to be aware of what medications they are taking, to dignity, privacy, and to be able to express their preferences when it comes to being given or taking medication, to give or withhold consent for any medical treatment or examinations, to register with a GP of their choice and choose a pharmacist, to recognize that the medication belongs to them and is their property, to have medication reviewed at least annually. If a person supported by shared lives is not able to give informed consent themselves, this will be discussed with the health professional, the person's representative or advocate and social worker, to agree a way forward. When a person is referred to shared lives, the shared lives scheme must obtain information about what medication that person requires and the extent to which the person can take responsibility for their medication. This information should be included in their assessment and care and support plans. The shared lives scheme should complete and regularly review a medication risk assessment. This must consider how much responsibility a person supported by shared lives can take for their own medication. Assisting a person in shared lives to take their medicine may involve helping them to take their medicines themselves or giving people their medicines. If a person is capable of self-medicating, they should be encouraged and supported to do so. For people supported by shared lives to consent to taking medication, they should have information about their health and the medication provided to them, in a form that they can understand. In general, medication cannot be given to a person if they do not consent unless there are exceptional circumstances. For over-the-counter medications, if the supported person has an existing condition, advice must be sought from the GP. Where no other medication is prescribed, then advice should be sought from the pharmacy. If a person supported by shared lives is prescribed drugs from the controlled drugs list, the shared lives carers should seek clarification and instruction from the person who has prescribed them on how to store. Detailed records of medications given to each person they support are completed and kept confidentially. The records will be reviewed by the shared lives scheme during their regular monitoring visits. When a person is referred to shared lives, their support or service user plan will detail, if necessary, how they like to be moved, supported to move, and what equipment or aids they need. Equipment or aids will only be provided after assessment by an appropriate professional, to enable the person to do as much as possible for themselves. Shared lives carers who may be helping people to move will be provided with training before any shared lives arrangement begins, and the use of aids and equipment will be kept under review. Some people will require support from their shared lives carer to meet their personal care needs. This may include support with aspects of daily living, such as washing, using the toilet, dressing, oral care, or eating and drinking. Before providing support, shared lives carers receive information and training that enables them to provide personal care safely and sensitively. Personal care support provided by the carer must follow the person's service user or support plan and any risk assessments. Respectful personal support will include closing doors and knocking before entering, wherever possible, to ensure privacy. Covering the person's private body parts, where possible. Preparing room temperature and equipment before the person is undressed. Allowing the person time on their own in the bathroom or toilet, wherever possible. Explaining clearly to the person what they are doing, ensuring consent is given and giving the individual choice and control. Using respectful language, communication methods, and being aware of cultural, religious needs. Being flexible about the times of bathing, getting up, going to bed, as far as possible, within normal family schedules. Enabling the person to do as much as possible for themselves. Follow good practice guidance. Assistance with mobility. Not making assumptions regarding the person's standards of hygiene. Seeking appropriate help and/or requesting additional training as appropriate. Protecting the person from abuse or harm and reporting any safeguarding concerns. Meeting the person's nutritional and hydrational needs. The service user support plan for the person will be regularly reviewed as part of the shared lives arrangement. When the person expresses a preference regarding support with personal care, this will be respected. If a person's cultural or religious customs have implications for their personal care, the shared lives carer will be properly informed about these, and wherever possible and when the person requests it, the shared lives carer providing intimate care will be of their preferred gender. During safeguarding incidents and investigations, the scheme will follow its own, as well as its local authorities, IFA-LA scheme, policies and procedures. During any safeguarding investigation, there are a number of considerations to take into account, which include ensuring that the wishes of the person using shared lives are at the center of any safeguarding inquiry. Whether the person supported by shared lives really needs to move out of the shared lives arrangement during an inquiry, and if this is what the person wants. Effective and regular communication continuing with the shared lives carer. To maintain integrity, respect, and a professional relationship with all involved during a safeguarding inquiry and ensure nothing is done to damage this. Asking for a clear conclusion to the safeguarding inquiry, that includes asking the person if there is anything else they want. There is detailed information around safeguarding in shared lives in our safeguarding training brief, and full information on all aspects of this content in the care planning and review training brief. Thank you for watching this brief overview of care planning and reviews in shared lives. Full detailed information can be found in the accompanying training brief. Please do refer to our other animated films for bite-sized information, or our training briefs for more detailed information on other topics.